So the work package I'm leading is on economic analysis, and in that work package we're looking at pressure of COVID on healthcare systems in Europe. We're also looking at the macroeconomic impact of both the virus and the countermeasures to control the virus on the economy. And finally, we're looking also at the cost effectiveness of interventions, taking account both the costs on the healthcare system and the costs to the wider economy. And that last part is something that we're going to be paying more and more attention to in the latter part of the project. When EpiPose started, we've already begun collecting data on the pressure on healthcare systems in Europe, which in the first wave was most important in Italy. And we used that experience to look at the relative healthcare pressure in other healthcare systems following after Italy, as they were under a huge pressure from the first wave of the pandemic. We developed a website where you can follow in real time the pressure on all these different countries' healthcare systems as the pandemic is evolving through time, and that website is still active today. We've also started estimating the economic impact of different scenarios of the pandemic. And we're collecting a lot of data to do that properly, and that is something we're using macroeconomic models for. And this is related also to work that we've done a long time ago in 2007, 2008, where we tried to make predictions of the macroeconomic impact of pandemics. And now we can do this again using more up-to-date data. And unfortunately, a real-life experience with a severe pandemic. For us as a research center, it's the main challenge is to balance all the different activities related to both COVID research and non-COVID research, and to keep everyone on board and in good spirits to continue the research. To me, I think that's the main challenge for us. Because our workload is very heavy and continues to be heavy, and that's taking its toll on people over time as we do this research. Well, what this crisis has done, I guess, in many fields is put people together who hadn't been working together otherwise, especially people across disciplines. I've always been involved in a lot of multidisciplinary research, but with the pandemic this has even increased, with people from totally different backgrounds joining forces for the same cause, and that's a rewarding thing as part of this crisis. In relation to the future, I think that a lot of the work will focus on how to best use the vaccines that we have and that will keep on becoming available over time to the best of our ability. So who should receive vaccines when? Should they be modified? What would be the optimal timing, optimal age groups to receive vaccines for a second time, maybe a third time? So there'll be a lot of research also on immunology to understand better how vaccine immunity may wane over time, or how it may need to be reboosted, so to speak, to protect us against escape mutants from earlier vaccines. So those kind of questions, I think, will be very important in the future, and that's where EpiPose can also continue to play a role.